Memedicine Cram Acyanotic Heart Disease. Flashcard 28, Patent Ductus Arteriosus. Acyanotic heart disease is a term given to a collection of usually congenital heart conditions. When I say congenital, I mean that the patient was born with it. And what happens is there's a perforation in the septum dividing the atria, the upper chambers of the heart, or the ventricles, the lower chambers of the heart. So here, obviously, we have a patent ductus arteriosus. There's not a perforation between the atria. There's actually a perforation between the two major blood vessels of the heart, which are the aorta. And here we have pictured the left pulmonary artery. Okay, and this is normal for a baby's circulatory system, but shortly after birth, this closes. And if it persists and remains open or patent, you can see that there's going to be a shunting of the oxygenated blood from the aorta to the pulmonary artery. Okay? All right. This deck of cards can be used for review for the National Council licensure examination. During an examination of an infant with a patent ductus arteriosus, the healthcare provider should expect to observe, select all that apply. Profound cyanosis. Okay, cyanosis is a bluish discoloration of the skin, and it's due to poor circulation or inadequate oxygenation of the blood. Okay. A widening pulse pressure. Pulse pressure, as many of you know, is the difference between the systolic and the diastolic pressure, where systolic comes from the root word systole, and it's the phase of the heartbeat where the heart muscles contract, okay, and they squeeze blood from the chambers into the arteries, either to the lungs or to the rest of the body. And diastolic comes from the root word diastole, and it's the period where the ventricles fill, okay, and relax. Or the atrial diastole is where the atria fill or relax with blood, okay? So systole or systole is contracting, and diastole is squeezing. It's relaxation and filling of either the atria, the upper chambers of the heart, or the ventricles, the lower chambers. Okay, so basically, pressure is measured in millimeters of mercury, and it represents the force the heart generates each time it contracts, okay? So the contraction, again, is systolic. If the resting pressure is 120 to 80 millimeters of mercury, where the 120 represents the force of the systolic phase of the heart contraction, and the 80 millimeters of mercury represents the pressure when the heart is in diastolic filling phase. Then the pulse pressure is the difference between these two, and it would be 40, because 120 millimeters of mercury minus 80 would be 40 millimeters of mercury. Okay, so a widening pulse pressure is what you could hear upon auscultation of the heart with a stethoscope. I can't say that word properly, stethoscope. And auscultation means just listening to bodily organs with a stethoscope or an audible, an audio device, something, to hear beats and thuds and thumps. Well, during the heart phase, you hear lub-dub. The lub is the systolic or the contraction phase. The dub is the resting phase or the diastolic phase, okay? So instead of hearing lub-dub, you would hear lub-dub. That's a widening pulse pressure. Sorry for that long spiel and everything, okay? systolic murmur. And remember that a heart murmur is a sound made during the heartbeat cycle, such as a whooshing or a swishing. This is made by turbulent blood in or near your heart, and it can be heard with a stethoscope, but it's not a good sound. It's not your normal lub. It's more of a violent sound. And again, a systolic murmur would occur during the heartbeat cycle, the part of the heartbeat cycle where you have a contraction, where the heart is squeezing blood from the ventricles to either the rest of the body or to the lungs to be filled with oxygen, okay? Is it option D, bounding peripheral pulses? Or is it option E, nail clubbing? Here goes another semi-disturbing picture. Nail clubbing is also known as digital clubbing. It can occur in the fingers or the toes, and it's associated with a number of diseases, but mostly due to heart and lung diseases, okay? So I'll give you a moment to select the correct observations, and remember to select all that apply. Okay? Okay. All right. So in general, infants with a patent ductus arteriosus won't be cyanotic. That means they won't have a blue discoloration of the skin. But as blood is shunted through the patent ductus arteriosus during systole, that's the contraction of the heart where the blood is squeezed out of both the left ventricle to pump blood to the rest of the body, as well as the right ventricle to pump blood to the left and right lungs. An audible murmur will be present. So we'll have a systolic murmur, okay? And as blood is shunted from the aorta to the pulmonary artery and to the left side of the body, the stroke volume is increased. Okay, so the amount of blood circulating is going to be increased, and this results in bounding peripheral pulses, increased systolic pressure coming from contraction of the right ventricle and the left ventricle. Okay. And there's also going to be a widening of the pressure pulse. So the lub-dub noise that a nurse or some other healthcare provider would hear during auscultation of the heart would sound more like lub-dub. Okay? All right.